Today's topic is Rumination Syndrome, causes, symptoms, diagnosis, and more. Rumination syndrome is a condition characterized by unintentionally regurgitating undigested food and spitting it out repeatedly. People with the condition may also regurgitate partially digested food from the stomach, re-chew it, and either spit it out or swallow again. This takes place at every meal soon after eating. The regurgitated food isn't bothersome since it is not digested and not acidic like vomit is. It is unclear as to why this condition occurs and who is at risk of it. However, it is treatable with a mixture of behavioral therapy and medication. Let's look at rumination syndrome in detail. Causes. As mentioned, the cause behind rumination syndrome is not known, but experts believe it to be linked with an increase in abdominal pressure. The condition is also known to occur in infants and people with disabilities. However, the syndrome can show up in people of all ages. Rumination syndrome is also believed to be more likely in people suffering from depression, anxiety, or other psychiatric disorders. The condition is often mistaken for bulimia nervosa, gastroparesis, and gastroesophageal disease, GERD, because of its symptoms. Symptoms. Symptoms of rumination syndrome are 1. Nausea. 2. Unintentional weight loss. 3. Bad breath. 4. Feeling full even without eating for long periods. 5. Effortless regurgitation of food, typically within 10 minutes of consumption. 6. Abdominal pain or pressure that usually goes away after regurgitation. Further complications that may arise due to rumination syndrome include 1. Malnutrition. 2. Dental erosion. 3. Unhealthy weight loss. 4. Social isolation. Diagnosis. A rumination syndrome diagnosis typically involves asking questions from the patient and performing a general examination. This is followed by observing behavior, which is usually enough to confirm a diagnosis. Tests are rare, but an impedance measurement and a high-resolution esophageal manometry may be required to complete the diagnosis procedure. These tests help determine if there is increased pressure on the abdomen. Treatment. Rumination syndrome is typically treated with behavioral therapy or medication. In some cases, a combination of the two may be necessary, especially if the condition leads to psychological issues. Behavioral therapy is the primary treatment option in cases where rumination syndrome shows up in people without developmental disabilities. Therapy helps them recognize signs of rumination and use of diaphragmatic breathing to subdue abdominal contractions. This helps them gradually learn how to control rumination. Stomach relaxants and proton pump inhibitors may be prescribed to keep digestive system and organs healthy. The latter is usually prescribed if the regurgitating is damaging the esophagus.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.